Well, thank you very much for inviting me today. This is your third evidence session after lunch in a row. Now, it's slightly different because the last two speakers have kind of talked about what I would say is generally one area each. So language and talked about perinatal, postnatal stress and antenatal stress. All very important. So how am I going to get through 21 outcomes right now? So you have to excuse me. It's going to be a bit of a whistle-stop tour. But what we do at the Institute of Health Equities, we don't tend to do primary research into as much depth as the last two speakers. But we tend to take the academic research and try and turn it into something that is helpful on the ground for children's centres or for policymakers. That's not to say that what's been presented isn't helpful, but sometimes they want a kind of broader look at issues. So that's what we have done for children's centres. We were asked by 4 children to do this piece of work. It started, Anne Longfield from 4 Children, who some of you may know, said to Michael Marmot, who happens to be my boss, "Oh, look, we're doing great things with children's centres." And he said, "How do you know?" And so we started a programme of work. The first piece of work looked at what outcomes children's centres needed to improve. So this work was based on literature review and talking to policymakers. We had an expert panel, of which Naomi was on and Ted. And we assimilated the evidence. We talked to 4 children's staff and came up with 21 outcomes. However, outcomes, that's not the same as measures. So these outcomes have all been chosen because they make a real difference to children's lives now. We believe that acting on those outcomes will reduce inequalities in children's outcomes now, but also into the future. So they have what we call predictive validity. They if you change these outcomes, then children's lives in the future will improve. So generally, just talking quickly about the outcomes themselves, they fall into 3 groups. There are a set of outcomes that are all to do with children's health and their development. There are a set of outcomes to do with parenting. And as we've seen today, children's skills in language are very important. What parents do is very important. But we have to remember that what parents do is very dependent on the kinds of lives that they lead. And so that the parents' lives outcomes are about, for instance, stress, money, and issues like that. So anyway, so after the outcomes work, we were tasked with finding ways to measure those outcomes. And again, an advisory group was set up with a variety of different stakeholders to make sure that we essentially kept on track, that we weren't coming up with anything too academic that wasn't usable, and that we also linked in with what children's centres were already having to do because of the existing frameworks that are around at the moment. Just quickly, something on why we need to measure. Well, the core purpose of children's centres is to improve outcomes for young children and their families, and also to reduce inequalities between families in greatest need and their peers. So in order to be able to illustrate that children's centres are achieving that, they need to have some measurement of some form. And also, I'll illustrate some of the measurement that's going on at the moment, but I think that if you have a clear set of measures that are used more widely across a wider number of children's centres, then that's actually helpful for inspectors, for commissioners. Many of the local area commissioners were saying, this would be really helpful for us. We want common measures so that we know when we look at outcomes which of our children's centres are doing well, what are they doing that's making that difference and which aren't doing so well. Okay. So yes, I was just going to say something about current measurement. Sorry, it's a bit small, this writing. But I think overall, I mentioned that there were measures to do with children and children's development, and I think that broadly children's centres are moving in the right direction with measuring children's development in a satisfactory way. They're all doing it slightly differently, and I think there's definitely a case for more common measurement. However, many children's centres are trying very hard to measure outcomes for children. However, a measurement of parenting or the context in which parents live is weaker. I mean, that may be totally understandable because the children are there, present, and maybe these aspects seem to be less important, or there are time issues. Children's centres tend to be measuring outputs quite a lot, such as the number of children reached and engaged by services, and that's not always sufficient. They often have case files for individual families that track and demonstrate improvements made by individual families, but they again wouldn't be comparable. And they have some soft outcome data about how parents feel or what they think their children have benefited from a service. And I mean, all of this is valid and may be very interesting and might help. However, I think there's from a more academic perspective, there's an issue about comparability and how valid those measures really are. Okay, so choosing measures, yes, we looked at the literature on measures. We aligned with Ofsted and the core purpose where we could, and we took opinions from children's centres, and we also collected data on what information they currently use and what measures they currently use. Okay, so the next few slides, I'm going to whistle through the outcomes as quickly as I can. However, I'm going to move from my podium. So this is the outcomes booklet, and this is the measures document. They're both available on our website. So if you do find yourself drifting off, you can find them on the website, and I'll put the website up at the end. Okay, so our first outcome is engagement, which wasn't actually in our kind of table of 21. And obviously that's very important because it doesn't matter what you do with children or what you do with parents if you're only reaching a few of them. So effective outreach and sustained engagement, and we mention a measure and how to do that. Now in this book, because I don't want you to be scribbling, we also say who should be doing it. So although there's lots in here for children's centres, there's other things in here for other people in the system as well. So for instance, percentage of disadvantaged families. I will move on, otherwise you're going to get very bored. I'm going backwards. Children's development. So age-appropriate drawing and copying, paying attention, comprehension of spoken written language, use of spoken written language, age-appropriate play, age-appropriate self-management and self-control. You will forget those, but it's all written up. And there's the measures on the next slide. So the reason we chose these measures, we picked up the importance of language. The reason we've chosen these measures is that these are highly correlated with outcomes now and outcomes in the future, so this slide, which has got the measures on, what I need to say here is that sometimes we haven't just said use one measure. So there's a star here. We'd like people to be using the Ages and Stages questionnaire. We think that the guidelines set for the early years measurement will be the Ages and Stages questionnaire. However, there are other forms of information you can use, such as the Early Years Foundation Stage Framework and all the supporting non-statutory guidance. The thing is, that's not actually based on peer-reviewed literature. It could be better. So we recommend the Ages and Stages questionnaire, but there are other things that could be utilised. Moving on to birth weight. Birth weight's important because it's associated with poorer health outcomes and risk of obesity. quite simple to measure. Fewer children with high or low BMI, high and low BMI, which is outside the normal distribution curve, is associated to a range of problems. Low birth weight is associated to more problems in terms of mainly physical health problems, but also low self-esteem for obesity. So again, there's a standardised measure there. Fewer mothers are exposed to tobacco smoke during pregnancy. Smoking is linked to low birth weight and a number of health issues. So we've got a star there with a cross through it. So actually the best way to know if somebody has smoked is whether or not they, when they breathe out, there's a high level of carbon monoxide. But we know that if you started doing that in children's centres, people would just leave in droves. And we know also that people lie. They will say, no, I'm not smoking, to the children's centre staff. So there's something about asking about who's smoking and looking at referral to smoking cessation programs there. Breastfeeding. Breastfeeding is important. It reduces the risk of obesity. There's a link to better health in the future and even IQ scores. I'd like to think that we were kind on mothers and said that it would be okay to totally or partially breastfeed. I think that the government recommendation is to totally breastfeed. So we have said that it's okay here to just support partial breastfeeding, because some is better than others, but that would obviously need to be looked at if it was going to become a government recommendation. Talking and reading to the child. So here we go on to things that the parents can do. I've said here, and it's been said I think before, but children from higher income households go to school with better vocabularies. Reading to children is associated with a reduction in inequalities of social and emotional problems at age 5. There are some outcomes and there's a measure. In terms of positive parenting, so there are influences in terms of how you, if a parent is positive towards their child, then that has a positive impact on their outcome. So yes, that's very good. Why don't you do a bit more of that kind of language, rather than, no, don't do this, don't do that. So we've got some outcomes here about more parents engaging positively. The improved parental responsiveness and secure parent-child attachment is about that early years bonding. Setting and reinforcing boundaries is important. So the importance is to have firm but not too authoritarian parenting. So for instance, we've got some people who work on the Millennium Cohort study at UCL, and they will say that actually regular bedtimes is incredibly important for outcomes in terms of children's sleep. So it's not about late bedtimes or early bedtimes, because you can adjust for those, but it's about irregular bedtimes. So there's an interesting data around that. Parents increasing their knowledge and application of good parenting. So it's all very well, we're saying all of these things about what parents should do. I've had 2 children. I don't think when I had my children I knew all of this. I don't think it's just for people who are at the lower end of the socioeconomic spectrum either, because for every single group who aren't the very, very highest class, there's a slight improvement. But if we just focus on those who are right at the bottom end of the income distribution, then we're missing most of the problem. So I think there's something about spreading the word about what you're supposed to do anyway. It's very difficult to be a parent. But again, a different scale here. Parental mental health. More parents are experiencing low levels of stress in their home and lives. Parents with good mental well-being. We've talked about that before, very important, so we don't need to say why. More parents have greater levels of support from friends or family. So as Naomi also mentioned, you can mitigate against some of the negative outcomes if you've got a bit more support, and but if you're socially isolated, it's harder. Parental skills. So if parents are improving their basic skills in literacy and numeracy, well, it will make it easier for them to talk to their children, use more words, use a wider range of words, and it will also be helpful for their own employment. Their money might go up, might be less stress. So linked to that, parental employment. So final slide, next steps. Our guide is as good as the information that's currently available. I think there's definitely something that could be done for children's centres, which takes some of the measures that we've suggested and some of the measurement scales, pardon me, and makes them a little bit more user-friendly. We have got some areas who are using this. 4 children are going to be testing it out as well. We do recognise that data collection is time-consuming. It's going to require training and resource. And I think that will do for now. Okay, thanks very much.
Thank you.